Today's video topic is comorbidities and immunocompromised immune systems. So I'm going to start by reading the definitions, and I'm going to relate to why I'm talking about these two terms today. So comorbidities is a medical term, and it's the simultaneous presence of two or more diseases of medical conditions. Some examples are cardiovascular diseases such as heart disease, strokes, metabolic disorders, osteoporosis, skeletal muscular dysfunction, anxiety, cognitive issues such as when people get older and have brain issues, gastrointestinal, respiratory, high blood pressure, diabetes, obesity, arthritis, and cancer. So these all are examples of comorbidities where you have two or more disease conditions in a physical body. So the next definition, next term I'm going to define from just information I have is immunocompromised or immunocompromised immune systems. So that is a weakened or suppressed immune system, making a person more vulnerable to infection and other illnesses. So the reason I'm bringing these two terms up today, two medical terms, is because in 2020, when I first started doing some of my videos and started exploring the health and wellness concept as something I would promote to others based on the things that I've been doing in my life for many years or many decades, COVID-19 had just begun and it was raging. COVID-19 was a weak virus, but it preyed on weak physical bodies. That was its prey. People with comorbidities or immunocompromised immune systems. And they talked about it in the news all the time. So they talked about being fearful, wearing masks, socially distancing, and being careful as to where you would go or who you would see. And that was about it. And then eventually the panacea was being announced that hopefully at some point the white knight on a white horse would come, and that would be a vaccine. The one thing that I never heard, which I didn't really expect because I'd never heard it before, was ways in which you could prevent comorbidities, ways in which you could prevent immunocompromised immune systems. How would you do that? By boosting your immune system. And that's what my YouTube channel is all about. Things that I've been doing for many years and for many decades with foods, with movement, and with essential vitamins and minerals and other supplements, ways in which you can boost your immune system. And to bring back the concept that food is, as I mentioned in the other videos, and I'll mention it more and more often, is the definition of food is something that promotes cellular growth and or promotes cellular repair. And that's it. There's many molecules in grocery stores or that you can order online that are molecules. They're not really food based on that definition because they don't promote cellular growth and they don't promote cellular repair. Those are the only purposes of food. It's not to get a sugar high. It's not something that's going to be savory and buttery and melt in your mouth like fast food. So part of my YouTube channel is to promote healthier foods, God's foods, as I've mentioned before, versus man's food made by the mad scientists who are part of the money changers who I'll talk about later. So why did the news media never talk about ways to prevent comorbidities and to prevent immunocompromised immune systems? Because really, it is socially unacceptable because we're talking about God's food. We are talking about questioning the system of food that's provided for us by corporations in conjunction with government. And I'll be talking about some government agencies, some of the alphabet letters, like the public health agencies. Money is made by the money changers, and I'm going to be saying this more and more often, on foods that are addictive, foods that are cheap, and foods that don't have any nutritious value at all. And that's the whole purpose of food. The foods that will prevent comorbidities and prevent compromised immune systems come from God, mainly. And some lightly processed foods that don't have added sugars, added salts and fats, and have an extracted fiber, okay? All those things make a food more tastier and increase shelf life and make it more convenient. So the whole purpose of my YouTube channel is to educate you and to go forward to educate yourself from other sources also. And I'll cite some of the sources I use, such as in some of the videos from the medical professionals on the negative effects of ultra-processed foods. And they go over from a metabolical and from a physical perspective and they're the experts. They're trained in the physical body. I'm not trained in that, but I am trained in research. I am trained in finding things to do to make my life healthier, to help me live longer, to help me work longer, to help me be help me be a productive member of society longer, and not to retire at an early age, not to go into a nursing home at the age of 100 or 120 or 130. Those are mind-blowing concepts, I know, because that's way out of the paradigm that we exist in today. So again, compromised immune systems and comorbidities or immunocompromised immune systems, these are problems that you don't have to deal with, that are treated with drugs and surgery and other things that can be prevented. The body is a self-healing mechanism. You need to give it the right ingredients. Do you pour sugar water or water in your oil container for your car? No, that would F up your engine, okay? Why do you think we have obesity? Obesity, degenerative diseases are produced by a physical body that's out of balance. That's dis-ease. That's a disease. It's dis-ease, meaning it's not at ease, okay? We are brought up not to know about this stuff. Our doctors really, they'll whitewash things and say, oh yeah, eat a healthy diet and blah, blah, blah. But they don't really go into the nitty gritty because they're not trained. They're not trained for that. They're trained to treat diseases. They are trained to use drugs and surgery to handle problems. They're not part of the preventative team. Prevention is not getting a medical test to make sure you don't have colon cancer. That's not called prevention. Prevention is eating fiber-rich foods, nutrient-dense foods, and taking nutritional supplements, having a system. So right now, our current system, if you walk into Kroger's, where I go to, or Myers, or any other grocery store, and you look at all the garbage, I have other terms that I won't use because children might listen to this video, that we should not be ingesting, we should not be putting into our body, okay? And so again, if you like this video, like it. Subscribe to my YouTube channel. Check out my other videos, and if you like them, subscribe. And if you like them, more will be coming. And refer friends and family. This is a group effort. It does take a village to help make us healthy again. Let's make America healthy again, okay? Let's cut back let's not depend on Medicaid. Let's not depend on Medicare. And I'll have some possible programs that you will not hear from Democratic or Republican politicians Because the only way to really solve our culture of disease management is to go to the root cause, and that's our food. 3 times a day on average, if you're lucky, 7 days a week, we eat food. That's the building blocks of your body. What your body has produced is because of the food you eat. If you do not like what your body has produced, if you do not like what is going on with your body, if you do not like how you feel, then you need to choose differently. And it's not easy. And the solution isn't $1,000 or $1,300 a month GLP-1. And I'll have more to say about those later, in addition to medical professionals talking about those. So anyway, have a good day, stay healthy, and study, learn. It's your body. 15 minutes to an hour a week researching what you need to do to take care of your body, because no one else is going to take care of your body for you except you. No one else controls what goes in your mouth but you. Okay? So good luck. Have a good day.